Hello, I'm Dr. Spoorthi Ramineni, General Physician and Endocrinologist at Akkineni Hospital. I hope you're in good health. Let's explore some key aspects of today's topic. Please stay with us and note them.
Okay, so you get a medical report back and you see those two words, fatty liver. It sounds not great, but you feel totally fine. So what do you do? That's what we're going to break down today, what that diagnosis really means and why it's a quiet signal you absolutely can't afford to ignore. So let's just put ourselves in that situation. A scan report says fatty liver, but you feel perfectly normal. There's no pain, no weird symptoms, nothing. And look, your first instinct is probably to just shrug it off, right? A lot of people do. But trust me, ignoring that little note on your report might be one of the biggest health mistakes you can make. And get this, we're not talking about some rare, obscure condition here. In urban Indian populations, it's estimated that 1 out of every 3 people has it. 1 in 3. It's basically a silent epidemic that's just hiding in plain sight. So what exactly is this thing that's so common but so easy to just brush aside? Let's dive in and unpack what fatty liver is and why we're calling it a silent warning. All right, so the official medical term is non-alcoholic fatty liver disease, or NAFLD for short, and it's pretty much what it sounds like. Now, a little bit of fat in your liver is totally normal, but with NAFLD, that fat starts to build up until it makes up more than 5 to 10% of your liver's entire weight. And that's the tipping point, where all that extra fat really starts to mess with how the organ does its job. And here's the tricky part. The reason it's so sneaky, you usually don't feel a thing. There's no sharp pain or obvious discomfort. You might feel a little tired or maybe a vague sense of heaviness, but I mean, who doesn't feel that way sometimes? It's so easy to just blame it on a long week at work. And that's why it's a silent condition. Really big changes are happening inside your body long before you ever feel a single symptom. Okay, so if it's not causing any obvious symptoms, where in the world does it come from? And that question leads us to the most important part of this whole discussion, the real root cause. And I'm willing to bet it's not what you think. When you hear fatty liver, your mind immediately goes to dietary fat, right? Like too much fried food, too much oil. It seems logical. But that's actually one of the biggest misconceptions out there. The true cause? Well, it runs much deeper than just the food on your plate. And here it is. The primary culprit is something called insulin resistance. So think of insulin as a key. Its job is to unlock your body's cells, to let sugar in so you can use it for energy. But when you have insulin resistance, it's like the locks on your cells get all rusty and sticky. They start ignoring the key. And so the sugar can't get inside to be used as fuel. So how does that lead to a fatty liver? Well, it's like a domino effect. You eat or drink something with sugar. Your body sends out insulin, the key, but your cells are resistant. They don't open the door. So now you've got all this extra sugar just floating around in your bloodstream with nowhere to go. That's when your liver, your body's amazing processing plant, has to step in to handle the overflow. It takes all that extra sugar and converts it into fat to be stored away. And guess where a lot of that new fat gets stored? Right inside the liver itself. And this leads us to the single most important idea to grasp. Fatty liver is not just a liver problem. It's a metabolic problem. It's a symptom of a much, much bigger issue that's happening across your entire system. Once you understand that key idea, the whole picture starts to make a lot more sense. The problem isn't just isolated to your liver, it's a system-wide issue. So let's take a look at what that actually means for your health as a whole. You see, fatty liver almost never shows up to the party alone. It's usually a key player in what doctors call metabolic syndrome, basically a whole cluster of conditions that dramatically increase your risk for other serious problems. We're talking about things like diabetes, high cholesterol, hormonal issues like PCOS, and even heart disease. They're all connected, and they all tend to stem from that same root cause we just talked about, insulin resistance. So what happens if this silent warning just gets ignored? Well, for a lot of people, maybe 70 to 80%, it might just stay as simple fat accumulation. But, and this is a really big but, for that other 20 to 30%, it can quietly get worse. It can progress to inflammation, then scarring, and eventually even permanent liver damage, all while you might not feel a single thing until it's really, really advanced. Okay, I know we've laid out the problem and the risks, and it can all sound a bit daunting, but the story absolutely does not end there. And this, right here, is the hopeful part. There is a very clear path to reversal. And that path starts with a huge shift in how we think about the problem. The old advice was super simplistic. Oh, you have a fatty liver? Just lose some weight and cut back on oil. But the modern, much more effective approach asks a smarter question. Wait a minute. Why did this happen to me in the first place? It's all about digging deep and finding that root cause.
And finding that why is what lets us build a real comprehensive plan. This isn't a one-size-fits-all thing. It starts with a detailed evaluation, looking at your insulin levels, your body composition, the whole metabolic picture. Then, that information is used to create a personalized plan that goes way beyond just diet and exercise. It looks at crucial things like sleep and stress, with medical support and constant monitoring to make sure you're actually moving in the right direction.
This whole comprehensive approach is all about one single goal, which brings us to our final and honestly most important section, reclaiming your health. If you take away only one thing today, please let it be this: fatty liver is reversible, especially when it's caught and you act on it early. This diagnosis is not some kind of life sentence. Think of it as a call to action. And you know what? The path to that reversal is probably way more manageable than you imagine. For many people, a modest weight reduction of just 5 to 10%, that's it, is enough to seriously decrease the fat in the liver and improve its health. It makes a goal that might feel huge seem suddenly very, very achievable. So let's reframe how we see this. It's not just a condition. Think of a fatty liver diagnosis as an early warning light on your body's dashboard. It's a signal, a friendly heads up from your body telling you that it's time to pay attention to your underlying metabolic health before a much bigger problem develops down the road. Which brings us right back around full circle. We know that fatty liver is the signal. We know that insulin resistance is the real driver behind it. But that just begs the next big question, doesn't it? What exactly is insulin resistance? Why does it happen? And what else is it doing to your body? We'll tackle all of that in our next explainer.